First, let's talk about abdominal pain. The interesting thing about abdominal pain is that it's very difficult to diagnose in the field. There's two types of pain. Visceral pain, which is from an organ. That's very vague. Visceral, think vague. Very hard to localize. It may radiate to funny places. It's hard to tell. But then there's somatic, sometimes called peritoneal pain, right? When an organ bleeds, or like your appendix gets really, really big and full of pus, it kind of knocks on your peritoneum, and then it can be located. That's somatic pain. Somebody can point to their pain, it's one thing. Vague pain is totally different from that. And also, when it comes to abdominal pain, sometimes the most severe pain is the least serious condition. In fact, vague pain can actually be serious. Think about kidney stones and the pains caused by that. Probably isn't going to kill you, but it's really going to get your attention. However, if your appendix or your liver or your spleen is damaged, it may be very vague until it's too late. Now, in medical patients, diagnosis, I know that word sets some people off, but it's really important that we think about what's wrong with the patient. Because in EMS, we have a big toolbox that we can use to fix medical problems. In that diagnosis, one of the most important, but sometimes underutilized things is whether it came on suddenly or gradually. Things that come on sudden, asthma attacks, MIs, strokes, anaphylaxis. Things that come on a little bit more slowly, like pneumonia, infectious conditions, and may have a fever. Don't forget how important sudden versus gradual can be.